Welcome to Resource 1 of Emergency Department in Luton and Dunstable. Today we're going to talk about how to check the airway trolley. When you look at the long view of Resource 1 bay, at the far left is the airway trolley. Now let's go through the airway trolley and then see how to check whether it is adequately stocked. The first thing is at the rear of the airway trolley, you have a QR code. If you scan this QR code with your phone's camera, then it opens a link to the Google document. And once you're in the Google document, then it has the list of all the things that we need to check for in the equipment. So if you look at the front of the airway trolley, then you have plan A, plan B, plan C, plan D. So as we go through each trolley, equipment within each drawer, then you would understand what plan A, B, C, D is. But to give a brief idea about plan A to D, plan A is the first thing that you would do when you're about to secure a definitive airway. And if the plan A were to fail, then the next rescue is plan B. And if it were to fail, then you move to plan C. And if all things fail, and when you're in a situation where you can't intubate or can't ventilate, and that is when you go to plan D, which is the front of neck access. So to begin with, I'll explain how to go through the checklist. So the first thing is the kit dump. As you can see, this is the kit dump, and this has images of all the basic equipment that you would need. So this is a laryngoscope, this is a suction catheter, you can see the laryngoscopes, the syringes, and then you have the bag valve mask, you have the laryngeal mask airways, you have the nasopharyngeal airways, and the oropharyngeal airways. So let's go through the checklist here. So let me open up the tray for plan A. So I've opened up plan A. Let me put this here, and then we'll go through each and every equipment. So the first thing is MAC plate size 4. So these are the MAC plates here. You can see there is MAC size 4 and then MAC size 3. So we have MAC 4 and MAC 3. Sometimes the blades can be packed individually, in which case you have the handle. So this is the handle, and then this is the blade. Whereas if you look at MAC 3, the blade and the handle come together as a single set. So just please be mindful whether you have the whole thing in the packet or whether you have the handle and the blade separately. So these are Macintosh blades. Then next thing is you need ET tube size 8 and size 7. So if you look at the ET tubes are stocked here, and then if you look at them, these are tracheal tubes, and then you can see the size here. So this is size 8, 2 of them, size 8, and then this is size 7 and size 7. And just for additional safety, we have smaller diameters, size 6 as well. So imagine the situation, as you're intubating the patient, the first thing you would need is a laryngoscope, which is a direct laryngoscope, and then you visualize the vocal cords, and then you pass the tube through it. But then before you pass the tube, sometimes we may have to use a bougie or a stillet. So which is why the bougie and the stillet are placed here. So this is a stillet. If it is bent, then it retains its shape, whereas a bougie is flexible and quite malleable. It's not a rigid thing, and as soon as you visualize the vocal cords and you pass the bougie into the glottis. Then the next thing is once the bougie is stillet, once the bougie and the stillet are in the glottis, then you need some lubrication for the tube to pass through. So which is why we have OptiLubes here. we have 4 optilobes here. And then once the tube is in, then you have to inflate the cuff. So to be able to inflate the cuff, you need a syringe. So you have a 10 cc syringe here, which is used to inflate the balloon at the end of the endotracheal. Now, the next thing is, before we intubate the patient, we have to have certain things ready, which is oxygenation for pre-oxygenation, and we need suction. So when you turn on the suction, you have a rigid suction catheter, and then the suction is readily available on your left-hand side of the trolley. So to turn the suction on, you see here, this is the off button, and then you flip this around, and then now suction is on, and you turn this off. Likewise, you have oxygen supply here, so you can go up to 15 liters, and you need an oxygen delivery device. So for which we use water circuit. So this is the water circuit we have available here. So this is the tubing which goes into the oxygen, and then you need a mask to connect to the other end of it. So the masks are available in plan C, which we'll talk about. So now once the tube is in, then you have to obviously connect it to the monitor, to the ventilator. So to connect it to the ventilator, we have a connecting T-piece, which is here. And at the far end of the T-piece, you need a bacterial filter as well. So we have all of this kit ready here. And now once the tube is in place, you need an end-tidal CO2 sensor to see that the tube is in the right position, which is why we have the end-tidal CO2 sensors readily available here. And then we have oxygen tubing, which is to provide what's called as apneic oxygen. So if the patient is in apnea, and then you have this nasal specs on, you can still passively deliver 4 liters of oxygen. And then once the tube is in place, you need tape to secure it at the desired length at the lips. So which is why we have elastoplast as well. So now all of this kit is ready, and if everything goes well, then with your plan A, the patient is intubated and connected to the ventilator. So this is the equipment that is there in plan A. So once you have checked that everything is available, then you're all ready to go. However, if there are any bits of equipment that is missing, then we have the stock room at in the corridor outside recess, and then you can get the missing pieces from there. Now once plan A is done, then let's move to plan B. So in plan B, essentially we have laryngeal mask airways. So we have 2 types of devices. One is iGel, the other one is a plain LMA. So you can see iGels, we have size 3, size 4 and size 5 based on the body weight of the patient, estimated body weight of the patient. Likewise, we have iGel, inflatable iGels, size 3, 4, 5, again same based on the body weight. And then as you're passing the tube, you need some lubrication, so which is why you have OptiLube readily available in here. And once the tube is in place, then you need a tube tie. So a tube tie is readily available in plan B. So that's the thing with plan B. Now let's assume you're unable to pass, you're unable to get an LMA or an iGel on. Then you want to put either a nasopharyngeal airway or an oropharyngeal airway and continue with bag mask ventilation. So let me show you the nasopharyngeal airways and the oropharyngeal airways. So we have 3 colors here available based on the size: green, yellow and red. So these are the oropharyngeal airways based on the patient's facial size. You can have them ready. And then you have nasopharyngeal airways, size 6 and size 7. You need 2 of them for each nostril. So this is size 6 and this is size 7. And then we have the face masks as well. This is size 3, 4 and 5. familiarize yourself with the colors as well. The other end of it can be connected to the water circuit. Now that's our plan C, tray stocked. Now next up is plan D. So plan D is if we end up in a situation of can't intubate or can't ventilate, then we have to get front of neck access by tracheostomy, and then we need the equipment for that. So the first thing is obviously you want to clean the skin, so you have chloroprep sticks ready. The second thing is you need a scalpel, so you have a scalpel ready here. The third thing is you want a tracheal. Once you made an incision, we need a tracheal dilator. So we have a tracheal dilator here. Once the incision is dilated, then you want to pass a bougie. So you have an additional bougie available here. And then to railroad on top of the bougie, you need a smaller size tracheostomy tube. So which is why if we have size 6 tracheostomy tube. So this is size 6 tracheostomy tube. Once we have this, and now you want to secure this in position, so which is why we have a suture kit. So this is the standard suture kit that we have in here, along with 10 silk to secure this in place. So now that's our plan A to D completed for the airway trolley. And always look for the bag valve mask, which hangs from the corner of the trolley here. Now once plan A to D are done, then we have the special equipment which is called the CMAC. So the CMAC displays are stocked here. So this is the CMAC display, and then at the other end you can see a connector. So this connector goes into a CMAC blade, and then I'll show you where to find the CMAC blades. So on the other end of the trolley, so you can see this is a CMAC pediatric blade. Then we have a CMAC size 4 blade. We have a CMAC size 3 blade. We have a CMAC size D, so which is a hyperangulated blade. Which are these two. So once these checks are done, before the start of the early shift and before the start of the night shift, and every time the airway trolley has been used. Now once the Google document is filled, then you can add this to your clinical governance contribution section. Thank you.